good evening, everyone, wherever you are. Welcome back to our Wednesday Wellness webinar brought to you by Asia Premier One Source. And once again, this is your Human Relations Manager, Ria. And for today, I'm very excited because we have a great topic that everyone can really connect to because this is everyone sleeps. So I think this is very important, especially for those who are working, and not only for those working from home, but also working on site, or even normally in in the household, diba? Or everyone at home can listen to this. And for those who are inside the Zoom live right now, you'll have a chance to ask question to our very special guest. But before that, I now have someone that will be joining me every Wednesday. So let us welcome our clinic and wellness lead, Nurse EJ. Hi, Nurse.
Hello.
Yeah, so thank you so much, Nurse, for joining me. And you would actually see Nurse EJ more often because she would be also conducting this Wellness Wednesday. So what do we have for today, Nurse?
The speaker actually is a very interesting person, and I know she's also related to me because she's also a nurse, and she pursued her career as a doctor,
Oh.
specifically more on the skin.
All right. So this is a great opportunity for us because we'll be talking about, as you can see on the screen, so sleep. Brought to you by Asia Premier One Source. Let us all welcome our guest speaker for today, Doc Pau, or Dr. Pauline
Pauline
Mai Navarro-Corbilla. She's an
Corbilla.
occupational health medicine and dermatology aesthetics. So wait lang, huwag kayong magulat. O, on na niyo yung video niya. Let us all welcome her. Doc, welcome, Doc.
Hello.
Hi,
Hello. I
Doc.
can't open my video. Hello. Good morning, everyone.
There.
Yes, and let's put spotlight on Doc Pau. She's so pretty. Good
Grabe.
morning.
Hello. Good
Good morning,
morning,
Doc.
everyone.
How are
So
you, Doc, this pandemic?
I'm okay. I'm okay. Well, stressed kasi, well, not hindi lang naman yung the industry nyo nagkaroon ng change when it
Yes.
comes to sa trabaho. Of course, sa amin din meron. Especially dun sa aking line of work, I'm a dermatology and aesthetic doctor now. So, syempre, hindi siya necessity. So, we are closed most of the time, especially
Mm-hmm.
kapag ECQ. So, it's just at this time na GCQ to when our clinics are allowed to open. So, ngayon lang kami nag-resume. So, I have a lot of time.
Yes, and we appreciate your time coming in today to share with us. And I see that apart from you being dermatology and aesthetics talaga, you're also practicing your occupational health medicine, which we are
Yes,
tapping on right now. So, Doc,
that's true.
I know that you've also prepared this presentation for us in terms of sleep. Pero like before I even transition this to you, yun nga, nabanggit naman natin this pandemic really affects everyone, and at the same time this is a very timely opportunity to talk about sleep kasi Nurse Ed, what can you say about the issues naman, the data that we have in our clinic and in our organization that entails or that is connected to sleep?
Of course, because of the pandemic, there are a lot of us are anxious. So there are times that some people or some of our agents or employees really experiencing lack of sleep. Sometimes they are having a difficulty to get a good sleep. So that's why we collaborated with you so that you can discuss more about sleep and how important it is to our health.
Yes, okay, so let's get started. Doc, take it away.
Okay. So, today we will be talking about sleep. So everyone sleeps. So basically, we this is of great importance now, especially there are a lot of changes that have been happening, especially at the time of pandemic. So sleep is affected talaga, and I have got a lot of consults online and face-to-face consults regarding lack of sleep. Let's start with the presentation. So first is the definition of sleep. So, sleep is a natural state of rest wherein our body reduces the responsiveness and also the motor activity. And this is where our body relaxes. Our central nervous system also stops for a while, and functions came in just like so, and the other functions of sleep came in. So the very function of sleep is the restoration of our body, also for energy conservation and for consolidation of memory, and of course learning. So before, when I was reviewing for board exam, usually we are reviewing the whole day. Our professors would usually advise us to have naps in between, for our memories to be turned into long-term memory. So how will that happen? So that usually happens during sleep kasi. The
Effective pala yung nap, Doc, no?
yes, the transformation or the from short-term memory to long-term memory happens when you are sleeping. So, yun talaga yung usually ginagawa ng mga tao. Dapat kapag nag-aaral, meron tayong naps in between.
Nako, parang puwedeng-puwede rin 'tong i-apply sa mga moms ngayon na nag-homeschooling kasi yung mga kids, 'di ba? We
True.
don't know pala na if straight sila nag-aaral parang minsan antok-antok sila so they have to listen to their bodies and talagang nap din 'pag kailangan.
Yes, that's true.
Kids. For the
Usually
kids,
kasi
huwag niyong tulugan yung office.
ang moms, ang teacher ngayon sa bahay kahit na hindi talaga nila forte yung pagtuturo. So,
Correct.
kailangan ng sleep talaga. Well, aside from that, syempre, kapag children, they need sleep for growth, physical and mental growth for the kids. So the next one discusses about circadian rhythm. So this is just the circadian rhythm is basically the biological clock of our body. So here, it depends kung you're a morning person or an evening person. So circadian rhythm is just it wakes you up. So in a day, usually if you're a morning person, you have a specific time to when your body is mostly active, and usually this depends on the lighting. This is when your body temperature, your metabolism, and the release of hormones is most active. So, dito nagfa-function lahat ng body mo. So, dito mo kailangan isabay all of your activities. So, activities just like exercise, of course, your daily work, dito mo siya ginagawa during the peak of circadian rhythm. So, this one, you usually have to synchronize this with the light. So, yung mga tao, kung bakit sila nahihirapan, especially in your case, people in the BPO company, usually, di ba, you work at night or
Yes.
morning shift ba?
Mm.
So, morning and evening shift. So, usually kasi, our body is accustomed to function well kapag there is good lighting. So, usually, it's advised na i-open yung lights if you're night shift kasi yung light, when it comes in contact to the retina, it releases a hormone that gives you enough energy to function throughout the day. So, that's why then, yung mga tao, mas nakakatulog if mas madilim yung ilaw. So, yun yung function
Right.
of circadian rhythm. So,
Okay.
another one is yung sleep-wake homeostasis naman. This one just basically tells us na even though you have to stay awake for a long period of time, your body will shut down. Kahit anong gawin mo, there will come a time that your body will tell you, I need to sleep. You have to sleep. So let me share to you an experience. Pag doctor ka kasi, you have to stay in the hospital, or maybe in your case, you have to stay at the office for a long period of time. Hours in the hospital, we have to stay around 36 to 72 hours awake. So, during an operation, nakatayo ka lang doon and you have to assist, nakatulog ako. kasi hindi ko na siya kaya. So that's the sleep-wake homeostasis. It tells your body na you've already consumed all the energy that you had, and you have to stop and at least take a nap to recharge. So that's the function of your sleep-wake homeostasis. Meron lang siyang drive for sleep, meron siyang drive for wakefulness. So kunwari, yun na yung kunwari nagda-drive ka and then bigla kang napapikit, that's sleep-wake homeostasis. So it tells your body you've you've reached the limit. Okay. And then next is, well, there are factors that affects sleep wake homeostasis. So there are certain medical conditions. There are certain medications that affects it. So example with medical condition, usually if you are diabetic, you are mostly sleepy most of the time. Also, if you're pregnant, if you've noticed, kung buntis, you are sleepy most of the time. With medications naman, there are a lot of medications that affects your wakefulness. Also, stress. If you've noticed, if you're stressed, you usually became parang mostly sleepy throughout the day. Also, if you are exposed to a sleeping environment, to an environment not conducive for sleep, you tend to feel sleepy as well. Again, as I said kanina, exposure to light, because light has a direct effect on your sleep or wakefulness, and also the food you eat and any the food you eat, ano mga example? Well, caffeinated beverages, caffeinated drinks, yung mga coffee, chocolates. They say, well, tea is a stimulant, but they say chamomile tea in particular, it causes relaxation. But all other caffeinated, carbonated drinks or heavy meals in general affects your wakefulness. Yun yung nakaka-affect din sa ating sleep-wake homeostasis. Kaya yung iba, kapag kunwari, they're reviewing, or they need to be awake, kapag nag-energy drink or coffee. So usually, we tend to tell our patients that if you're planning to drink or consume those kinds of food, or or drinks, you have to at least consume it 2 or 3 hours before your sleeping schedule para hindi niya talaga totally ma-disrupt yung sleeping pattern mo. Okay, next. Well, there is an average time that a person needs sleep. Well, a baby sleeps 16 to 8 hours. A school age child needs 9 to 10 hours. While an adult like us, we only need 6 to 8 hours of sleep. Pero, especially now at the time of pandemic, usually wala kang masyadong ginagawa at home, so you tend to sleep or oversleep, which oversleeping, as I said a while ago, meron siyang direct correlation to your emotions. So, pwedeng kaya ka oversleep, it's because you're too stressed or you just want to relax because the your day has been too stressful, yung day before had been too stressful, so na-affect yung number of hours of sleep mo. Next, I will be talking about sleep at the time of pandemic. This is very timely now kasi syempre, at this time sa pandemic, marami tayong iniisip. We've been too stressed, and then kapag stressed tayo, here comes anxiety already. And then, syempre 'pag anxious ka na, medyo ang dami mong iniisip. Like for example, paano ko ba babayaran yung bills, especially now, no work, no pay, or no means to go to work kasi suspended lahat ng mga transport vehicles. So, ang dami mong iniisip. Like, paano na yung school ng child ko, paano ko i-jumble yung mga work ko para sa bahay, and also my responsibility at work, responsibility to my child, paano yon. So, marami tayong problems now wherein it results to discouragement, there is stress of uncertainty hanggang kailan itong situation na to, and a pool of negative emotions na nagkakos ng, well, stress-related fatigue. So, and in the evening, we find it so hard to sleep kasi nga, nagkakaroon tayo ng um, madaming iniisip when we launch our sleep. So, and also, nagkakaroon tayo ng in the middle of the night wakefulness kasi hindi siya, we are not well rested. So, ito yung anxiety that manifests at bedtime. So other people, they tend to resort to alcoholism or asking doctors to prescribe medications to help them sleep when hindi naman talaga kailangan. Usually if a patient comes into me and asks me kung anong medication is appropriate to take kasi hindi sila makatulog, usually we advise mga non-medication practices muna para to help them sleep. Kasi syempre, medications will disrupt holistically yung function ng katawan mo. So, hindi lang siya sleep yung ma-affect. Yes, you will get the sleep that you need, pero hindi siya yung rested sleep. So, hindi pa rin siya makakatulong. Kasi if you sleep, you have to be able to relax as well. And kasi kung hindi ka relax, you will be awake in the middle of the night then. So, what are the effects of lack of sleep? So, there are a lot. Again, sabi ko nga kanina, with sleep, this helps our memory, our learning, our cognition, and also, again, our emotions. So, during sleep, na-enhance or na-activate yung amygdala natin. This is a part of the brain that releases happy hormones that controls their emotions. So, dito, pag lumalabas yung happy hormones natin, of course, pagkagising natin, we feel recharged, we feel better. So, kapag you don't get enough sleep again, mababa yung happy hormones mo pagkagising mo. So, you tend to have more negative thoughts. Also, it affects your memory kasi um, bumababa yung hormone to retain the memory. So, usually, it affects your learning also. And then, you tend to have weight gain. So, kaya ka nagkakaroon ng weight gain is because yung cortisol production in the body is also affected with lack of sleep. You tend to release more of ghrelin that stimulates your appetite kapag kulang ka sa tulog. So, mas feeling mo parang gutom ka, mas marami kang cravings when you don't get enough sleep. So, you tend to gain weight. Also, um, with lack of sleep, you have poor coordination and responsiveness, low sex drive. Well, this one, it's because of low levels of testosterone and in females estrogen. So, nakaka-affect din siya sa female and male hormones natin. When you lack sleep, um, mababa yung sex drive because you also lack these hormones that you need. Again, weak immune system kasi nga syempre mababa again yung hormones kasi hindi ka nakapag fully recharge. So, let's move on to tips to get healthy sleep. So, next slide. So, to get a healthy sleep, usually patients, we or you yourself should set a schedule to when you have to do your daily work. So, example, usually ngayon, we do work from home. So, um, my husband kasi, he's working from home, but he doesn't have a fixed work schedule. But to people with fixed work schedule, you can make a timeline for yourself for the whole day so that your sleeping pattern will not be affected. So, dun lang sa specific schedule to when you need to do your work, dun mo siya gagawin. So if your work starts from 6 to 3 p.m., so you work from 6 to 3 p.m., you finish your deadlines on schedule, so you don't have to work and extend your schedule dun sa given time that you set for yourself. Para meron ka ding time in sa remaining of the day that you can do things, mga leisure activities mo, you can do exercise. If you're a parent, you can play with your child. You can watch a movie uh, to to be relaxed. So, yun yung mga pwede mong gawin. To get a good sleep also, they say you have to get to have good exercise. At least 20 to 30 minutes of exercise can help you relax a few hours before going to bed. So some people they do their exercise in the morning, but it is advised daw, and you tend to get a good sleep if you do your exercise 2 to 3 hours before bedtime. So you do your exercise at that time para maganda yung sleep mo. And then third tip is to unplug before bed. So you don't touch your computer, you don't touch your phone kasi blue screen tends to, again, the light affects the retina. So pag ganun, yung kapag exposed ka pa sa too much light, gising na gising pa yung brain mo. So you have to talagang transition from yung good lighting to dark lighting para ma-signal yung brain mo that it's time to sleep. Also, again, as discussed a while ago, avoid eating heavy, also caffeine and nicotine. Well, nicotine in cigarettes, though. Alcoholic drinks is also not advised before bedtime. Kasi, well, drinks will help you fall asleep. Talaga namang nakakaantok siya. Pero you will have to wake up in the middle of the night kasi also with caffeinated drinks kasi nga ano siya, stimulant siya. So you have to wake up to go to the restroom or kaya meron kang disrupted sleep sa middle of the night. So hindi rin siya advised to take alcohol or caffeinated drinks. Um, Eating heavy, well, eating heavy kasi your brain will, the blood circulation will tend to focus on your GI system. So, hindi ka talaga makakatulog kasi kailangan yung circulation will focus on the brain at the time of your sleep for you to be able to launch a good sleep. Kapag nakain ka ng marami before sleep or before bedtime, kailangan niyang magkaroon ng sufficient or enough digestion. So, mag-increase yung circulation sa GI system. So, talagang mahihirapan yung brain mo to sleep, to launch sleep. And then, next is, if you find yourself having a hard time na matulog in the evening, it's best to avoid daytime naps. So, daytime naps kasi usually napapahaba siya. You don't really set the schedule kasi when you're taking daytime naps. So, it's best to skip it if you find yourself not being able to launch sleep easily at night. Also, um, you develop practices or habits that will help your quarantine fatigue or stress. So at this time, again, we have a lot in mind. Marami tayong iniisip with the uncertainty ng pandemic. So it's best na kung kunwari matutulog ka na, hindi mo isipin yung mga bagay na negative. So, how do you keep yourself from doing that? So, throughout the day, syempre, pagurin mo yung sarili mo. But, not to the point na sobrang pagod ha. So, what can you do? You develop a new hobby. Yung mga tao ngayon, if you can see sa social media, they're into plants. So, well, plants is relaxing. So, you can try to be a plantito or a plantita. Um, Also, you can play good music before bedtime, or you can play music in bedtime. So, para maka-help yun na ma-set the mood for sleeping. Also, pwede rin naman na read a book, or you can also do something relaxing for you, like ask a massage from your husband kung you're married, ganyan. So, that's it. Or you can plan an activity to look forward to when the pandemic ends, para hindi lang yung puro negative yung napo-focus mo. So, instead of thinking what will happen tomorrow, start thinking ahead. So, plan your future with your husband, or plan your future yourself. Um, Mag-isip ka ng mga productive ways, if to productive ways for yourself. So, for example, me, as I said, affected din yung career ko. It doesn't mean that I'm a doctor. I have a lot of ano patients, kasi again, I was introduced to dermatology and aesthetic physician. Ngayon, yung line of work namin is considered as non-necessity. So, hindi namin, our clinics are closed, our patients cannot see us, kahit na ito yung best opportunity for them to really have yung mga aesthetic procedures done, kasi hindi sila makikita, they don't have to deal with the downtime, patients don't have to go out of their houses. So, ngayon sana yung pinaka-best na magpagawa ng ilong, magpaliit ng chin, mawala yung double chin, magpapayat, ganyan. So, but we can't really practice now kasi nga close yung clinic. So, I'm thinking of alternative ways to earn a living. So, as an occupational and health doctor, napapractice ko pa rin yung aking profession by, again, this one, doing webinars, or, well, I do home visits, I do home consultations to patients. So, ganon. So, you find an alternative hobby, you find an alternative kung ngayon yung work mo yung hindi ka productive or you're not earning, you find an alternative for you to earn. So, yung iba, they resort to online business, online selling, ganyan. So, para hindi ka totally mag-focus doon sa negative effect that the pandemic brought us. So, next is, um, next is you have to be able to relax before bed. So, yung tinatawag na sleep hygiene, you have to practice that. Others, they want a warm bath. Ako, I prefer a cold bath, kasi mas refreshing siya, mas masarap matulog. If you yung iba naman ayaw nilang maligo prior to sleeping. So, I advise that you do your sleep hygiene regimen mga 2 hours prior your sleeping time. Kasi minsan, kapag nakaligo ka, magigising ka eh. Kasi, yun nga, malamig yung water. Pero, um, you have to just set a schedule. Oil diffusing now is also a thing. So you can do aromatherapy at home, or create a room conducive for sleep. So yung kwarto mo dapat lagi yan, walang cellphone dyan, walang laptop dyan. Um, yung ambience, it's for sleeping only. So, well, don't watch TV. So sabi nila, yung iba kasi they put TV in the bedroom. So it's advisable that you don't have television on your bedroom, para talaga for sleep lang siya. Bed is for sleeping. Yun yung masiset ng mind mo. So when you're on your bedroom, it's just for sleep. Also, if you find yourself awake kahit na nakahiga ka na. And you can't really launch sleep kahit gaano katagal mo nang nag-try para makatulog. Uh, we advise that you don't continue to try sleeping. You stand up, do something else, and then you let yourself relax. So, do something else. Ano yun? So, you can watch a movie muna kung hindi ka pa talaga inaantok. Um, or read a book again, pero not on bed. Hindi siya, yung mga sinasabi ko kanina, you don't do that sa bed talaga. You do that outside the bedroom again. You stand up and you don't do it inside the bedroom. And then lastly, if all of those things won't help you, you can consult a doctor. Um, so you can get an advice from us. We recommend over-the-counter medications that could help you launch sleep. But basically, to my patients, I don't really recommend muna yung mga medications na nakaka-launch ng sleep. I usually advise patients muna to try food na rich in tryptophan if you've already heard of that because tryptophan helps you to sleep soundly. So it's mostly found sa banana, broccoli, cauliflower, mga ganun. So nuts. So those food will help you launch sleep better rather than resorting to alcohol or drinking over the counter sleeping aids. So it's best to start yung mga non-pharmacologic treatments muna or interventions muna. And keep in mind na kasi yung iba, di ako makatulog. They always think paulit-ulit and they worry about not being able to sleep. So, kailangan you have to keep in mind na all sleeping disorders can be addressed and it's mostly in the mind kung bakit hindi ka makatulog. So, um, the reason behind you not being able to launch sleep is because you're anxious or you tend to overthink. So you have to clear your head before sleeping for you to be able to um, launch a good sleep at night. So lastly, um, well, you have to develop a work-life balance. This applies to all of you guys. Work-life balance. So you have to keep in mind, yung iba kasi, hindi lang yung pandemic sila stress. In the case of people doing work from home, since they are still working from home with limited resources, they tend to worry about their work. Also, yung productivity nila is also affected, of course, kasi there are a lot of factors na nakaka-apekto sa concentration mo during your time of work kapag nasa bahay ka. So, you have to be able to make a new work routine. So, as I said, you have to develop a new daily schedule. So, meron ka dapat time lang for work. So, for example, again, your shift is 6 to 3. Working schedule yun, 6 to 3 only. 3 p.m. onwards, yeah, that's the time na you can schedule yung mga gusto mo nang gawin for yourself. That's the time that you can schedule non-negotiable me time. So, dun papasok yung mga sinabi ko kaninang relaxation na mga hobbies, mga ganyan, music, diffusing and all, ganyan. While working naman, during your work schedule, you can follow the Pomodoro technique. So this technique also applies to everybody kahit hindi nag-work or for example, you just need to finish something. You're a student, you have to be able to study for a long period of time. Pomodoro technique will help you kasi this one, you have to, for example, you're assigned a task, you choose the task that you have to finish, set a timer, you have to be able to, finish. 'Di ba? So, 'pag nasa work ka, you have to be able to focus. So, 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 you have to be to do the tasks straight without any disturbance ng 25 minutes dun sa or distraction. Without distraction dun sa 25 minutes, you have to be able to focus on it, to do it, work on it. And then after 25 minutes, you can record your task progression. So, for example, you're able to finish half of it. You can relax, take a 5-minute break, get coffee, uh, ano pa ba? Check your phone, check your social media, do whatever you can do in the 5-minute period just to be able to feel relaxed again and then get back to working again. So that one you repeat continuously until you finish your work schedule. So ang sabi kasi nila, our mind is only able to focus kahit adults 25 minutes lang daw. 25 to 30 minutes lang daw. So, kapag nag-exceed ka na doon, you tend to think outside of what you're doing already. Your focus is out of the thing that you're doing already. So, it's best to just set 25 minutes of working and then take 5 minutes break in between para talagang matapos mo yung specific task that you want to accomplish during the day. So that's the Pomodoro technique. And of course, since we're at the time of pandemic and people all have our, ano ba, lahat tayo may pinagdadaanan, you have to not be hard on yourself. And also, not be too hard on your coworker. So you have to be extra patient and understanding at this time because um, well, pwedeng sa atin or kayo ay wala kayong masyadong iniintindi sa ngayon, ano, you have a perfect working schedule. You were able to finish your task on time. You're not stressed. You're not anxious because you have everything in front of you. Pero paano naman si coworker? Baka wala pala siyang good internet connection, pero nainis ka kasi nag-log out siya bigla during the meeting. So, it's best to, sabi nga nila, it pays to be extra kind at these times because we don't know what each other is going through at this, especially at this time. So, well, if you extend an extra leap of kindness to someone, it will come back to you. So, yung mga negativity, shoo muna. So, keep away from negative people. Be positive yourself so you can radiate it to others and others could radiate positivity to you too. And advice, if you saw someone who's being negative in general, kung talagang sobrang stressful siya and you're working with that person, ask that person to stop working first. Tell him or her to relax, to be able to focus on the agenda for today. Um, and then, go back to work pag okay na siya. So, yun yung best. Kailangan mong maging extra kind and patient to everyone now because we all have our
Agree.
baggages. We all have
Yeah,
meron tayong mga kanya-kanyang pinagdadaanan. So,
that's
it may
true.
not it may not show kasi hindi naman lahat ay nakikita social media, especially now we don't see each other. Hindi ka pwedeng makapagkwento to your friends or you can't vent out even to your family minsan. So it pays to have someone who's extra understanding when it comes to work or ano. Pero wag mo namang abusado. Meron lang siyang certain degree to how much we can take, diba? So, yun
Right.
lang. Dapat
Yeah.
lang positive, positive, positive. And it's the
Correct.
end of the presentation.
Yay! We've moved
Uh,
now to our question and answer. Doc, I will stop the sharing so everybody can see us right now kasi we have questions on the box coming from our
yes.
colleagues too.
Actually,
So
kanina ko pa siya tinitignan.
let's start. We will be asking that we will be reading the question anyway. Pero before we move on to the question and answer, sobrang ang daming learnings talaga from what you've explained kasi sometimes we know it but it's hard to apply it, or even if there's knowledge minsan hindi rin immediately alam how we'll be able to go about it. So the first question, nurse, anong nasa ating mahiwagang box?
First question, what is the best or recommended time to sleep?
Siguro given na yung
Oh,
normal yung schedule niya like this.
yes. Given the normal schedule, it says that the normal sleeping time is at 10 p.m. Sobrang early,
Mm.
di ba? Pero kasi at this time, usually nga, or yung mga ka-generation natin, we tend to sleep later at night. Usually mga 1 a.m., 2 a.m., 3 a.m. So it depends again on your circadian rhythm kung kailan siya. Kasi kaya nga tayo merong jet lag na tinatawag. It's because of our circadian rhythm. So you have to develop a rhythm as to
Mhm.
when your body will ask you to sleep. So, recommended talaga is 10 p.m. But you can always deviate on that. Pwede pa rin siya talagang mabago. So, what we stick to is the recommended hours of sleep or yung length ng sleep. So, they say the best is 6 to 8 hours. If you can get more than that, it's okay. As long as after that, you feel energized or relaxed.
Right.
Meron kasing natutulog na 6 to 8 hours pero pagising hindi ka pa rin well rested or you feel na parang hindi naman ako natulog, inaantok
Parang
pa rin
mababaw
ako.
yung ano nila, no,
Yes,
sleep
mababaw
nila.
yung sleep.
Mm.
So, again, it's because of others, it's because of taking caffeine before sleeping or taking alcohol before sleeping or again, overthinking before sleeping. Yung napapanaginipan mo na kung ano yung ino-overthink mo. Yun
Yung
usually yung
akala ko nagtatrabaho pa ako sa panaginip pero hay, natutulog na pala.
yes,
Yeah,
oo. So,
correct.
usually talaga, it's best to clear your mind before sleeping. You
Yeah.
develop a relaxing hobby before sleeping para pag natulog ka, tulog ka talaga.
Yan. Thanks, Doc. Another question from Mara. What are the long-term effects naman daw, Doc, of sleep deprivation? I think this applies not only to to the moms, really. There's what we call momby, sleep
Yes,
deprivation. And for those working then na sometimes they have the opportunity to sleep, but they maximize, syempre, other things din na kukulangan pa rin yung sleep.
that's
So, ano
true.
yun?
Well, there are a lot of long-term effects ng sleep deprivation. So, with sleep being deprived, again, memory loss is number one. Mas lalo kang makakalimutin
Mm.
when you lack sleep. And follows yung mga lifestyle diseases like diabetes, hypertension, heart disease. So, bakit siya nangyayari? So, with sleep deprivation, again, yung hormones natin is altered, yung mga neurotransmitters natin. Kasi, sleeping is a brain function. So, if your brain is altered or the neurotransmitters that signals your body to do something is affected, it affects your body holistically. So, well, kung hindi ka well rested or you don't get enough sleep, um, dito na papasok yung magkakaroon ka ng diabetes kasi nga again, kanina yung sinabi ko na you tend to eat more because your hormones, ghrelin, cortisol, is not regulated. So, mas madami kang kainin, your sugar levels will be affected. In turn, magkakaroon ka ng diabetes. Also, there are foods that we eat that increases the blood thickness or viscosity. Yung circulation naman natin yung affected. the blood circulation naman yung affected, which in turn affects naman or results to hypertension. So, yung iba, kapag overwork, over fatigue, they develop hypertension, in which hypertension is, ano siya, parang first step to developing heart disease. So, we advise patients to get good rest para yung blood circulation natin will be improved. Kasi nga, with sleep, blood circulation, hormone regulation, and body function, nare-realign siya. So, makakaiwas tayo dun sa mga lifestyle diseases na yun. Long-term effect of sleep, well, sleep deprivation, they say, well, psychological wise, again, hindi lang siya sa memory loss, it affects your emotion, you will notice you become irritable, yung iba, if it's very long na, it's been a very long time, usually 2 days straight of not sleeping, 2 to 3 days straight of not sleeping, you develop hallucinations. Based on studies ito, you
Mm.
develop hallucinations. If you already have a history of psychological illness or disease, makaka-aggravate siya. So, to those patients who have bipolar disorders, pinaka-iniiwasan is hindi sila makatulog. That's why kasama sa mga medications nila yung relaxants and sleep inducers. Also yung ano, ano pa ba? To patients who lack sleep, syempre, our coordination is affected. Yun yung unang-una na affected din as well. So, coordination, not only when, example is when driving, or kapag when performing task, usually dapat, di ba, meron tayong fina-follow na timeline or meron tayong fina-follow na sunod-sunod, pero we tend to forget that because our body is not well
Nandep-
rested. Yes.
Yeah.
So, yun yung mga long-term
Grabe, ang dami
effects.
pala, no? Like, I mean, ang daming
Yes.
benefit ng sleep, pero at the same time, if you forget that very essential part of being human, di ba? Dami
Yes.
niyang magiging compromise. There's ano pa yung isang question I saw earlier, ano eh.
The third question is, what is the cause of sleep paralysis?
Okay.
Mm.
Sleep paralysis per se is very vague. Well, sleep paralysis is a disorder. So it depends on, meron siyang clause under it. So with sleep paralysis, merong sleep apnea. Merong nangyayaring sleep apnea to where parang during your sleep, you feel like parang hindi ka makahinga. Or, well, paralysis during sleep talagang nangyayari ito kasi we lose our musculoskeletal function during
Mm.
sleep.
Yeah.
Kasi nga, we're sleeping. So,
Mm-mm.
hindi ka talaga mawawala yung control mo with your musculoskeletal muscles. But sleep paralysis per se, as an illness, marami siya underneath it. So,
Pero may mga
we
subcategory pa ba to, Doc, nung
Yes,
ano?
meron siyang mga subcategories like OSA or obstructive sleep apnea.
Mm.
Meron ding sleep paralysis talaga, which yung I would like to ask her kung anong sleep paralysis yung
Mm. Dok,
she
paano
would
yung
like to
ano,
address.
halimbawa, ang nakikita ko mga cases ng sleep paralysis, yung tipong hindi talaga nila ma-move yung body nila, even if on their mind, let's say, they wanna wake up,
Mm-hmm.
but even if there's a will to wake up and
Mm-hmm.
move the body, parang they're having a hard time doing that. So, gising na yung
Mm-hmm.
diwa nila, pero the body still, parang, paano, hindi nila ma-move. Parang ganun. Meron ba yun, Dok?
That's true. Meron talagang gano'n, pero
Mm.
usually it's just psychological. So usually patients with sleep paralysis, experiencing sleep paralysis na yung feeling nila gising na sila pero hindi pa talaga. Those patients only needs reassurance. Usually, yung good sleep hygiene practice prior to sleeping, makakatulong din siya for you to not experience sleep paralysis.
Mm-mm.
Others, dahil nga, as I said, it's just a others kasi they think if psychological yung problem, ano siya eh, ay baliw na ako. There's a stigma.
Mm-mm.
Um, pero hindi talaga. You need, if you are experiencing sleep paralysis, na ganong extent, you have to seek help kasi
Yeah.
you have to be reassured. It has to be
Mm-mm.
explained to you kung anong nangyayari,
Mm-mm.
bakit yun yung na-experience mo. Usually, those people who experience sleep paralysis, it's because of bad experiences, meron silang post-traumatic stress disorder, meron
Yeah.
silang past experience that led to them
Uh-uh.
having sleep problems. So,
Correct.
ang treatment talaga is others, they do cognitive behavioral therapy or they are prescribed antidepressants kasi most of them are just depressed
Ah,
dahil nga merong prior event that led to
right.
them not being able to sleep.
So
So,
talagang ano, it's a case to case basis. So I guess better
yes,
na they would narrate what is
that's
happening
true.
to them to the doctor talaga to get a proper explanation then.
Yes. Kaya
Yeah.
ang medical history is very important talaga for the doctor to be able to
Mm-mm.
know kung ano talaga yung problema and for the doctor to be able to address and give you
Mm-mm.
specific treatment that you need. Kasi very vague yung sleep paralysis. Marami siyang
Yeah.
merong alcohol use sleep paralysis,
Sanga-sanga na siya.
sleep
Yeah.
apnea. Yes,
Mm-mm.
meron siyang subcategories.
Correct. Ito,
So,
Doc, may isa. Actually, this is the last question na. Are there any side effects for taking melatonin pills po? Oy, kayo may mga bayad na itong anong to. Ito na yung last, Doc. Ito na yung last na question. Yung
scary.
melatonin pills, di parang ano to, part of ano rin, another hormone that's produced in the body?
That's true. Melatonin kasi, it's a normal hormone that induces sleep. So, well, melatonin, nakikita ko to na pwede talagang i-purchase over the counter. Um, well, to go back to the question, kung meron ba siyang side effect, it's safe to take melatonin generally because, again, ito ay normal naman sa ating katawan, but not in excessive consumption, hindi yung maramihan. Usually, it has side effects. One is daytime sleepiness kapag kahit na nakasleep ka na kasi usually kasi they tend to drink a lot, lalo kung kunwari, nakainom na ako pero hindi pa rin ako inaantok, inom pa siya ulit. So, during the daytime, it's when you notice na mas inaantok ka na kasi nga, marami ka na masyadong nainom. Or, common side effects includes headache, dizziness, stomach discomfort such as diarrhea, also anxiety. Kasi bakit you keep on thinking, why do I even need to drink melatonin or sleeping aids para makatulog? Bakit naman yung iba nakakatulog naman sila? So it causes anxiety in return. Also, you have a feeling na parang heavy yung head mo, which is normal din kapag nagtitake ka ng melatonin. Or, again, yung anxiety, it can lead to depressive states. So, depression, kasi nga parang marami ka nang iisipin eh kung bakit 'di ba kapag meron kang symptom, people tends to hindi naman overreact. People tends to overthink. Iisipin na nila ano ba yung nagko-cause? Bakit ako hindi makatulog? Siguro kasi ganito, ganito, ganito. So it leads to a lot of parang negative thoughts already na in turn nagiging depressive na to the person. So it's best not to
Right.
take pills again if it's not prescribed.
Recommended.
So
Yeah.
I don't have anything against naman over-the-counter medications. Others nga, they use diphenhydramine, yung mga anti-allergies, which hindi rin siya okay kasi hindi naman siya talaga specific for that
Mm-mm.
use.
Right. Let's not
Um,
self-medicate, guys, because
that's
that's
true.
why
So,
our medical practitioner is there to, if we need to seek
uh,
help. 'Diba?
And also, another thing, there will be drug interaction kasi if you're taking
Mm.
sleeping pills, nothing in particular, but if you're taking any medication for your health, like for diabetes, specifically blood thinning medications, it can,
Mm.
like aspirins, hindi ka pwedeng mag sleeping pills. Bawal kang mag melatonin. Also, kapag you're taking immunosuppressants, well, hindi naman siya, parang last concern mo pa yon. Persons with diabetes or those taking birth control pills. So, hindi siya okay talaga in general. So, we have to really seek consult first prior to taking any medications. Don't self-medicate kasi when you self-medicate, you don't know the drug-to-drug interaction.
Mm.
Baka magkaroon ng
Adverse.
complications in the end.
Yeah.
Yes, adverse reaction in the end. So,
Correct.
best pa din na to see a doctor for them to, again, first advise you of non-pharmacological treatment prior to you or prior to them resulting to pharmacological treatment in the end pag talagang hindi na talaga gumana yung mga interventions na in-recommend niya.
Nice. Thanks,
Ayun.
Doc, for answering the
You're welcome.
question. And this time naman, since we are okay, so guys, if you have cameras, please turn it on so we can do a groupie. This is the
Ay,
new groupie Zoom groupie. Because we have to take picture and yun nga, para we can have ano naman, we can post it in our social media. And while you're opening your screen, Doc, would you like to also share with us if you have, let's say, consultation, or if they want to, because you mentioned earlier too, no, that you do home visitation. So for those as well na parang they need to connect with you. Mm-mm.
Oh, okay. Well, basically now our clinics are open, pero onti pa lang. You can I'm doing clinics with Skin Station if you're
Kaya
familiar.
mga girls ang nandito, Skin Station
skin
girls, ang
station.
ang
Yes,
inyong
Skin
pagpapabot
Station.
na
You can
ng
message me
mm-mm.
directly to my FB page na lang. I'm sorry pala kasi it's my first time in speaking talaga on a lecture in a
Doc, hindi
webinar. So,
halatang first time.
med,
Sobrang ang
med,
dami naming
Hindi halata.
natutunan.
but if you would
Magandang,
like to consult to me personally, pwede naman. I could
yan.
help you. Just message me. You can message me on my Facebook account or you can send me a message through my mobile phone.
Grabe, may
So,
common friend ba tayo, Doc? Ayan na, na-visit ko na at nakita ko yung mga pictures. Guys, you can go ahead and Facebook
And
and then add
browse.
Doc.
oo,
Yan, Doc ha.
ayun, sige.
Alright, let's take a picture. Ayan. Buksan nyo na mga camera nyo. Yan na ba yan? Okay. So, ako mga mag-ano AIDS. Wait lang. 1, 2, 3. Okay, one more. 1, 2, 3. All right, Doc, thank you so
Thank
much for your
you.
time.
Thank you,
Thank you so much,
And
Doc.
thank you,
everyone. Maraming
everyone.
salamat.
We will see you again next week for our Wednesday Wellness webinar. Have a good Wednesday, everyone.